Namami Ramam Raghuvanshanatham. This video is for malarial fever, and it is malarial fever part 2. In this video, I am going to narrate you that which type of fever pyrexia is found in malarial fever. Hike of the temperature. All of a sudden you will see there will hike of the temperature of the body will be increased, and this is called hot stress. After some times patient gets sweating, and this is called cold stage. Temperature will be lower down, but it is not ideal. You can say that this hot stage and cold stage is found in all the fever of the malaria and all the time. No, there will not be hot stage and cold stage, but there will be malarial fever. Patient have tendency to vomit, that is nausea. Patient has nausea, patient has vomiting, and you will see patient gets exhausted after sweating. Many times it is seen there is no hot stage, there is only cold stage, and shivering of the patient is found. Shivering of the patient is found. Patient should be hydrated. 20% and 5% dextrose we should give with multivitamins. And as have I said you in video first, Plasmodium falciparum is the most lethal malarial fever, and Plasmodium resides in red blood corpuscles of the human body, and after rupture of the RBC, the Plasmodium is liberated in blood, and there is hike of bilirubin, so there will be jaundice. Now you can say that in falciparum malaria, jaundice with fever is found, but it is not found in Plasmodium ovale, Plasmodium Plasmodium malariae, and Plasmodium vivax. Another important thing I want to narrate, that in a patient of malaria, if you are going to test, many times, even I can say authentically that 60% cases, malarial antigen test is negative. Test is speaking that there is no malaria, but there is malaria. So we must not rely on the antigen test of malaria. We must not rely. 60% of the cases are negative. Now, if patient gets Plasmodium falciparum, the most effective medicine is quinine sulfate, 300 milligram tablet each. We should give 2 tablets thrice a day for 5 to 7 days with the advice of the clinician, because it may cause severe acidity, hypertension or hypoglycemia. Severe acidity, gastritis may be found with the use of quinine sulfate. Patient may have complain about hypoglycemia and hypotension. So proper hydration is maintained. IV fluid should be continued, so that we must not to face hypotension or hypoglycemia. The Plasmodium falciparum Plasmodium may reach to brain and may cause brain malaria. If this plasmodium has the capacity to cross the blood-brain barrier. A patient may be in coma. A patient may lose his consciousness and may enter into malarial coma, because now this is the situation when the fever is in brain, plasmodium is in the brain. This plasmodium resides in brain fever. So we should be alert enough that proper hydration and proper medicine should be given. Artemisinin, injection of artemisinin and injection of artesunates are also effective. But along with quinine sulfate, we should use doxycycline. 100 milligram capsules or tablets, morning and evening. All these medicines should be given after the advice of the doctor. Because I am narrating after taking medicine, there is maybe hypotension, blood pressure may be lowered and hypoglycemia. चीनी बहुत ही कम हो सकता है सिस्टम का. Hypoglycemia. Many times we get hot and cold stage, but not in Plasmodium falciparum. Plasmodium falciparum has the characteristic of continuous fever. We should take a notice that Plasmodium fever, in Plasmodium falciparum, jaundice may occur, but it is not related with liver. We must not confuse ourselves with jaundice, because hepatitis A virus is responsible for jaundice, that is making inflammation of the liver. This jaundice is of peculiar type, and this jaundice is due to raised bilirubin after the rupture of red blood corpuscles. When we travel, we must have mosquito repellent. Dear friends, you must hear my words. You must have mosquito repellent. If you have mosquito repellent in train, in bus, in car, mosquitoes will not come to your body and you will be safe. You will be in safer zone of malarial infection. And characteristically, other three, Plasmodium vivax, Plasmodium ovale and Plasmodium malariae, fever may come once in a day. After that, fever may come alternate day. One day fever will come, one day it will not come. It may come after 2 days. But in Plasmodium falciparum, fever is continuous. And this fever is also known as black water fever. Urine becomes black. Why? Due to excess supply of bilirubin, urobilinosin is not formed. So, we should consider a patient of fever and jaundice seriously, and we should go to diagnose the patient as Plasmodium falciparum. Plasmodium falciparum may cause brain fever. So, I am narrating you that you should be alert enough if you are in Bihar, Jharkhand, West Bengal. The season has been changed. This is the beginning of summer season. We must keep away from such types of mosquitoes biting and malarial fever. Blackheat is available. It affects and kills the malaria. And so many liquid are especially available. We should use those liquids to repel mosquitoes. Last and but not least, I want to say we should use mosquito net. In night, we must have clothes, full shirt and pajama covering the whole body so that mosquito not sit upon our body and may pour the plasmodium into our bloodstream. Fundamentally, malaria is a dangerous fever and we must be careful. We use mosquito repellent, total body cover, full dresses, mosquito net, all-out liquids are also capable to get out the mosquitoes, and there must not be place where the female anopheles may lay eggs, because female anopheles carry this plasmodium and it becomes hungry in the evening. In next chapter, I will discuss with you dengue fever. So in malarial fever, we may use medicine quinine, chloroquine, artesunate, artemether, paracetamol if required.